Have you ever felt butterflies in your stomach before an important presentation? Or a constant worry about the future? Anxiety affects millions of people worldwide and is considered the most common mental disorder today. In today's video, we will talk about what anxiety is, what its symptoms are, and the main factors that can worsen it. Anxiety is a normal reaction to a threat or psychological stress. Normal anxiety is rooted in fear and plays an important role in survival. When a person faces a dangerous situation, anxiety triggers a fight or flight response. This response causes various physical changes, such as increased blood flow to the heart and muscles, providing the body with the energy and strength needed to face life-threatening situations, such as escaping an aggressive animal or confronting an attacker. Anxiety can help a person adapt to common stressors by motivating them to prepare, practice, and rehearse. It can even encourage someone to approach potentially dangerous situations with proper caution. However, anxiety can be considered a disorder when it occurs at inappropriate times, with a frequency and intensity that interfere with daily activities. Anxiety disorders are the most common type of mental health problem, affecting approximately 30% of adults in the United States at some point in their lives. Significant anxiety can persist for several years, and a person may start to believe it is normal. For this and other reasons, anxiety disorders often go undiagnosed or untreated. They may also be associated with suicidal thoughts. Anxiety disorders can lead to many physical symptoms, such as nausea, vomiting, diarrhea, shortness of breath, choking sensation, dizziness, fainting, sweating, hot and cold flashes, palpitations, rapid heart rate, muscle tension, chest pain or tightness. These symptoms can be mistaken for other illnesses, delaying diagnosis and treatment. Once other medical conditions are ruled out, it is essential to consider that there may be a mental health issue that needs attention. The causes of anxiety disorders are not entirely known, but they can be triggered by environmental stressors, such as the end of an important relationship or exposure to a life-threatening disaster, genetic factors, physical illness, and certain medications. However, many people develop an anxiety disorder without an identifiable triggering factor. Anxiety tends to be hereditary. Doctors believe that some of these tendencies may be genetic, but others are likely acquired by living with anxious individuals. Many people developed anxiety disorders due to traumatic and stressful factors during the COVID-19 pandemic, and some still experience anxiety related to the pandemic or a COVID-19 infection. Factors that caused fear and anxiety or worsen the condition include symptoms like shortness of breath, corticosteroid treatment, illness or death of a loved one, the need for preventive measures, masks, hand washing, lockdowns, and many other personal or social factors, e.g., significant changes in daily routines, social isolation, or changes in school, work, family, or community. Additionally, some experts believe that COVID-19 infection induces a host immune response that leads to neuropsychiatric symptoms, e.g., anxiety, mood changes, neuromuscular dysfunction. It is evident that anxiety is multifactorial and linked to both simple and complex situations in each person's life. Some factors can worsen anxiety and should be avoided, such as excessive stress for a long period, lack of adequate sleep, caffeine and alcohol consumption, excessive use of social media, a sedentary lifestyle, and poor diet. Anxiety can be managed when we understand its causes and seek healthy ways to cope with it. The goal is not to eliminate it, as it serves an important function and is inherent to human nature. However, we live in a world that fosters anxiety-related problems. Identifying and understanding the factors that make it harmful, changing habits, and developing more internal resources help keep anxiety within healthy levels. Have you ever felt that your anxiety was worsened by any of the factors mentioned? Comment below. If this video helped you, leave a like and subscribe to the channel for more mental health tips. Remember, taking care of your mind is just as important as taking care of your body. Small changes can make a big difference.